LOLers, let's talk about the different components of fitness. What needs to be included? Should you be doing yoga or strength training, or should you be walking around the block? Let's put that all into perspective and make sure that we are strategic in the type of fitness you do. There are different times and places for different types of exercise, and the same thing certainly isn't appropriate for all of us. Start with safety. Make sure that your doctor approves of physical activity for you. Most doctors want you to move a little bit more, but make sure that your medication's in check, your blood pressure's in check, and that you don't have a bone or joint condition that would become exacerbated with physical activity. Most of us will have improvements in health and wellness with physical activity, and here's how. We're going to break fitness into 3 categories: cardio, vascular exercise. This is aerobic exercise. This does not mean aerobic classes necessarily. Some of you might remember the Jane Fonda days. That's fine. We can use some of those old videos. Step classes or other aerobic types of classes are fine, but it also refers to something that might be just the best for you, and that might be something that's more just like a simple walk around the block, or maybe just a walk to the mailbox. Those types of strategies will get the blood pumping, will certainly engage your lungs and your heart, and help you begin to strengthen the cardiovascular system. Aerobic exercise, for most of us, is appropriate daily without rest. Okay, so we don't necessarily need to take a break from cardiovascular exercise. You can walk every day. You don't need to take a break. Allow it to become part of your wellness plan, your routine, and you'll have great results with that. But it's not the only thing that you need. We certainly want to include some strength training. This is typically a part of your anaerobic exercise, meaning that your body does not necessarily have to use oxygen in order to perform this exercise. That's a little bit more technical. Don't worry about it too much. But essentially, you will still get out of breath after performing the exercises, but we'll call it anaerobic or strength training, okay? That means that you are using either body weight, dumbbells, cables, or bands. I have a few of them right here. So if you're using a dumbbell, this can be anywhere between 1 pound and even 100 pounds or more as far as what you're using for a dumbbell. There's a variety of ways to do it. Some people get stuck in a regular bicep curl, but we want to make sure that we use all big muscle groups, antagonistic muscle groups, to make sure you're getting the workout that you need. Check out our video series on strength training in order to get a better overview for that. It can be dumbbells, it can be your body weight, like a push-up, even a push-up against a wall, or bands. Lots of people get these from their physical therapists. Some have handles, some don't. As long as they're stretchy and you can work with it, that will be the same. We'll count that as the same. They're wonderful, inexpensive, and portable for those of you who travel for your jobs. Great strategy, okay? We can certainly get our strength training done there. So strength training is important. If we're going to perform strength training, we're going to get stronger. Our joints are typically going to feel better if we're doing it correctly. All right, so we want to make sure that you're getting 2 to 3 strength training sessions per week, and it doesn't need to be much. You can accomplish this in as little as 20 minutes in your living room. So it doesn't have to be going to the gym and doing a lot of heavy lifting. We want to make sure you're doing it correctly, but you can get this done pretty efficiently on your own at home. It doesn't even need to be at the same time. You can break that up in 5-minute increments and make it work for you. All right, so then the third category that we need to talk about is flexibility. This is where a lot of that yoga comes into play. Yoga is incredibly effective for helping our muscle imbalances correct themselves. Okay, so that's terrific. But sometimes we get stuck in our yoga routine. It does not necessarily burn a lot of calories, okay? It doesn't contribute to the improvement of your strength. It is wonderful for stress reduction. It is wonderful for helping us address those muscle imbalances, but it can't be the only thing, all right? So we want to incorporate part of it, but we need to incorporate the cardiovascular and the strength training as well. For those of you who don't want yoga, no worries. We can implement a flexibility regimen that you can do daily or maybe even weekly to help you accomplish those goals and to address your muscle imbalances. Your plan, though, needs cardiovascular, strength training, and flexibility regimens in order to be complete. So don't get hung up on one. Let's make all of it part of your routine. All right, L-Wellers, I look forward to talking with you about that in your individuals. Thanks.